Welcome to part 2 of the Mental Capacity Act Masterclass Psychiatry. I'm Dr. Prosper Tettey Doe. In the first scene, it was about examining a patient for capacity. Just to recap, it said you have been asked to interview a man who had been brought to hospital with hematemesis. He needs endoscopy but is refusing. Assess the patient's mental state and the capacity to refuse endoscopy. And in this case, after assessing the patient for capacity, you have to meet the surgery consultant regarding the next course of action. Devise a management plan. Note: you need to explain to the surgeon your opinion and back your opinion with the reasons. And also, the next course of action is to find out if there's an advance directive to help the team make an informed decision or a lasting power of attorney to contact. The physical condition being urgent, it will not be appropriate to wait for the psychosis to be treated. This station requires contacting the IMCA and the Court of Protection to keep them informed of the decision making. And this leads us to the next, which is the best interest principle. The decision should be based on the best interest principle, and I'll be mentioning 11 principles. But before then, the surgeon might be prepared to wait for about a week for the patient to regain his capacity. In such a situation, an antipsychotic or ECT can be tried under Mental Health Act. The hematemesis cannot be treated under Mental Health Act. It is important to inform the surgeon that the team might be in the same position after a week due to the very short time scale. After a week, the capacity assessment should be repeated. Discuss with the surgeon from the physical health point of view whether the patient needs to stay on surgical ward. If the surgeon wants the patient to be on a psychiatry ward, then discuss the management plan and be mindful of the fact that emergency medical care can be difficult to achieve in a psychiatric ward, and confirm that the surgeon or one of his team can review the patient at the psychiatry unit. Also agree on emergency treatment plan, like flagging the patient at the A&E. Now, regarding the best interest, the person making the decision must consider the following. A, whether it is likely that the person will at some point again regain capacity in relation to the matter in question. And B, if it appears likely that he will, when that is likely to be. Now, this next point is that he must, so far as reasonably practicable, permit and encourages the person to participate or to improve his ability to participate as fully as possible in any act done for him and any decision affecting him. The next principle is where the determination relates to life-sustaining treatment, he must not, in considering whether the treatment is in the best interest of the person concerned, be motivated by a desire to bring about his death. Next principle, he must consider, so far as is reasonable ascertainable, that the person's past and present wishes and feelings, and in particular, any relevant written statements made by him when he had capacity, Also, the beliefs and values that would be likely to influence the decision if he had capacity, and the other factors that he would like to consider if he were able to do so. And he must take into account if it is practicable and appropriate to consult them. The views of the following: anyone named by the person as someone to be consulted on the matter in question or on matters of that kind. Also, anyone engaged in caring for the person or interested in his welfare. Any donee of a lasting power of attorney granted by the person and deputy appointed for the person by the court. As to what would be in the person's best interest, and in particular, as to the matters mentioned in this subsection, the duties imposed by the subsections 1 to 7 also apply in relation to the exercise of any powers which are exercisable under power of attorney, lasting power of attorney to be precise, or are exercisable by a person under this act, where he reasonably believes that another person lacks capacity. The next principle: in the case of an act done or a decision made by a person other than the court, there is sufficient compliance with this section. If, having complied with the requirements of subsections 1 to 7, he reasonably believes that what he does or decides is in the best interest of the person concerned. It's a bit complicated, isn't it? The next principle is of life-sustaining treatments. This means treatment which, in the view of a person providing health care for the person concerned, is necessary to sustain life. And relevant circumstances are those of which the person making the determination is aware, and which it will be reasonable to regard as relevant. So this brings us to the end of these principles regarding capacity assessment or mental capacity. Thank you very much, and I wish you all the best in your career.